blood transfusion is the introduction of whole blood or blood components into the venous circulation. Human blood is commonly classified into four main groups: A, B, AB, and O. To avoid transfusing incompatible red blood cells, both blood donor and recipient are typed and their blood cross-matched. There are different kinds of blood products for transfusion. Number 1, the whole blood. It is not commonly used except for extreme cases of acute hemorrhage. Number 2, the packed red blood cells. It is used to increase the oxygen carrying capacity of blood in anemias, surgery, and disorders with slow bleeding. Number 3, the autologous red blood cells. It is used for blood replacement following planned elective surgery. Number 4, platelets. It replaces platelets in clients with bleeding disorders or platelet deficiency. Number 5, the fresh frozen plasma. It expands blood volume and provides clotting factors. Number 6, the albumin and plasma protein fraction. It is used to expand blood volume and to provide plasma proteins. Number 7, the clotting factors and cryoprecipitate. It is used for patients with clotting factor deficiencies. For the equipment, you have to have blood product, blood administration set, 250 ml normal saline for infusion, IV pole, venipuncture set containing a number 18 to number 20 gauge needle or catheter, or, if blood is to be administered quickly, a larger catheter, chlorhexidine solution, alcohol swabs, tape, and clean gloves. Number 1, you have to verify the primary care provider order for transfusion. Number 2, verify client consent and obtain baseline data before the transfusion. Number 3, verify that a signed consent form was obtained. Number 4, assess vital signs for baseline data, including blood pressure, pulse, respiratory rate and depth, and temperature. Number 5, determine any known allergies or previous adverse reactions to blood. Check the primary care provider's order with the requisition. Check the requisition form and the blood bag label with a laboratory technician or according to agency policy. Specifically, check the client's name, identification number, blood type and RH group, the blood donor number, and the expiration date of the blood. Observe the blood for abnormal color, RBC clumping, gas bubbles, and extraneous material. Return outdated or abnormal blood to the blood bank. With another nurse, compare the laboratory blood record with the client's name and identification number, the number on the blood bag label, the ABO group and RH type on the blood bag label. Sign the appropriate form with the other nurse according to the agency policy. Make sure that the blood is left at room temperature for no more than 30 minutes before starting the transfusion. Agencies may designate different times at which the blood must be returned to the blood bank if it has not been started. If the start of the transfusion is unexpectedly delayed, return the blood to the blood bank. Check the client's armband for name and ID number. Do not administer blood to a client without an armband. Ensure that the blood filter inside the drip chamber is suitable for whole blood or the blood components to be transfused. Put on gloves. Close all clamps on the Y set, the main flow rate clamp and both Y-line clamps. Using a twisting motion, insert the piercing pin into a container of a 0.9% saline solution. Hang the container on the IV pole about 1 meter above the venipuncture site. Open the upper clamp on the normal saline tubing and squeeze the drip chamber until it covers the filter and 1/3 of the drip chamber above the filter. Tap the filter chamber to expel any residual air in the filter. Open the main flow rate clamp and prime the tubing with saline. Open the saline and main flow rate clamps and adjust the flow rate. Use only the main flow rate clamp to adjust the rate. Invert the blood bag gently several times to mix the cells with the plasma. Expose the port on the blood bag by pulling back the tabs. Insert the remaining Y-set spike into the blood bag. Suspend the blood bag. Close the upper clamp below the IV saline solution in the Y-set. Open the clamp on the blood arm of the Y-set and prime the tubing. Blood will run into the saline-filled drip chamber. If necessary, squeeze the drip chamber to re-establish the liquid level with drip chamber 1/3 full. Readjust the flow rate with the main clamp. Run the blood slowly for the first 15 minutes at 20 drops per minute. Note adverse reactions such as chilling, nausea, vomiting, skin rash, or tachycardia. Record starting the blood, including vital signs, type of blood, blood unit number, sequence number, site of the venipuncture, size of the needle, and drip rate. "15 minutes after initiating the transfusion, check the vital signs of the client. If there are no signs of a reaction, establish the required flow rate. Most adults can tolerate receiving 1 unit of blood in 1.5 to 2 hours. Do not transfuse a unit of blood for longer than 4 hours. Assess the client including vital signs every 30 minutes or more often, depending on the health status, until 1 hour post-transfusion. If the client has a reaction and the blood is discontinued, send the blood bag and tubing to the laboratory for investigation of the blood. Put on clean gloves. If no infusion is to follow, clamp the blood tubing and remove the needle. If another transfusion is to follow, clamp the blood tubing and open the saline infusion arm. Blood administration sets are changed within 24 hours or after 4 to 6 units of blood per agency protocol. If the primary IV is to be continued, flush the maintenance line with saline solution. Disconnect the blood tubing system and re-establish the intravenous infusion using new tubing. Adjust the drip to the desired rate. Often, a normal saline or other solution is kept running in case of delayed reaction to the blood. Again, monitor vital signs. On the requisition attached to the blood unit, fill in time the transfusion was completed and the amount transfused. Attach one copy of the requisition to the client's record and another to the empty blood bag. Return the blood bag and requisition to the blood bank. Record completion of the transfusion, the amount of blood absorbed, the blood unit number, and the vital signs. Also record the transfusion on the IV flow sheet and INO record.